Most of us probably know someone who has a diabetes, but do we know how it impacts them? And do we know what help is available? And if there are preventative measures that we can take? Our guest today is going to talk about this. Candace Aqui is the Manager of Knowledge and Connection at Diabetes Canada. Candace, welcome to Bridge City News. Great to have you with us today.
Thanks so much for having me.
Okay, so how many people, well, let's just jump right into this, Candace. How many people in Canada actually have some form of diabetes? Because I understand there are different types.
Yes, there are. So, as it stands right now, about 4 million people are diagnosed with diabetes in Canada. So, that works out to about 10% of our population. And every 3 minutes, someone is diagnosed with diabetes. So, it is, a disease that is progressing. There are about 6 million people who are at risk for developing diabetes. And about 90% of the people diagnosed with diabetes live with type 2.
Okay, can you maybe explain what diabetes is?
Sure, absolutely. You were right. There are different types. People who live with type 1 diabetes aren't able to produce their own insulin. And that's because their body is attacking the pancreas, which is the organ that produces insulin. So it's considered an autoimmune condition. People with type 2 diabetes can't properly use the insulin that's made by their bodies, or their bodies aren't able to produce enough insulin. And then we have gestational diabetes, which is a temporary form of diabetes that occurs during pregnancy and may increase the risk for developing type 2 diabetes later in life for both the mother and the child. And then you've also might have heard of prediabetes, which is a condition where blood sugar levels are higher than normal, but are not yet high enough to be diagnosed as type 2 diabetes. So, although everyone with prediabetes may not actually develop type 2 diabetes, many people will.
Oh, that's so interesting. Do we know what exactly causes it at this point?
You know what? That's a great question, and I wish I had a clear answer to that. There are many factors that come into play with diabetes. So, as I just mentioned, with type 1, it is considered an autoimmune disease. With type 2, there are many factors. There's definitely a genetic component. We know there's a behavioral component, and there's an environmental component as well. So, it's very complex. We know that there are many tools that we can use to support people living with diabetes, but a clear, one sort of type of cause is very difficult to point them.
Okay, so is it unfair for people to say that you can develop diabetes based on an unhealthy lifestyle then?
Well, yeah, in a way, because again, there is that genetic component. And
Yeah.
one thing I really want to make clear is that people who develop diabetes, it's not one single thing that they did or would have experienced necessarily, and it certainly is not their fault. So I would say that it's not a fair statement. We want to think about diabetes as a very complex disease with many different components that contribute to developing it, and as well as many different components that contribute to how it progresses throughout the lifespan.
Okay, so with that said, then are there some preventative measures that we can possibly take?
Yes. One thing that's really important is to know if you have a high risk of developing diabetes. So that's exactly what we're trying to do this month with Diabetes Awareness Month is make the time to learn about risk factors. And we do have a risk factor calculator on our website. So again, if you have a family history of diabetes, that kind of thing, you want to sort of look into that. So knowing what your risks are, that's a great time to start having conversations with your healthcare provider and getting your blood sugar checked to see if there are risks there, if you're trending towards developing diabetes, and then starting to make a plan that will help to reduce that risk and also manage any potential complications that may arise.
Okay, and how does this disease impact the health of those with diabetes? And are there some like what are some of the risks over time?
Absolutely, absolutely. So the risks over time is that as diabetes progresses, you're at a higher risk of developing longer term complications such as kidney failure, heart attack, and limb amputation because diabetes is a vascular disease. It affects the blood vessels. Many people with diabetes are also at a higher risk for developing mental health issues because of the stress of managing diabetes. We refer to that as diabetes distress. So, as you can imagine, someone living with diabetes is never off the clock between measuring their blood sugar, calculating their doses of medication and remembering to take it, priming their insulin pump, for example, or educating their caregivers about what's happening with their disease. It really is almost like a part-time job.
Oh, sounds like it. It just sounds like it just becomes a part of your lifestyle. Like, absolutely. So, is there anything close to a cure then? Like, is there any promising research underway?
Yeah, there is research. So just to make it clear, there is no, at this point in time, there isn't a cure. And many people may think, well, insulin might be the cure, but it is not a cure. It's a treatment. Diabetes Canada is funding projects, about 260 projects with different researchers, to really sort of look at some of these questions. As a matter of fact, we've have funded two researchers, Dr. Remy Rabassa Lore and Dr. Ahmad Haider, who helped develop the artificial pancreas, which is an automated insulin delivery system. And this technology has really helped to reduce that mental load that comes with living with diabetes and increases the amount of time that people can spend in the right range for them for their blood glucose. And that really does help to improve their quality of life as well.
Okay, and I'm told that type 2 diabetes is controlled with diets and pills. Is that correct?
Not exactly. There really is no one size fits all approach with managing diabetes. Again, as I mentioned, it's a very complex disease, and it really depends on several factors. So, when someone is diagnosed, how long they may have had it prior to getting a diagnosis, that can affect how you treat it. We do know, obviously, that lifestyle behavior changes is a big component. It's just one tool in the toolbox, though. We want to think of diabetes as having many tools that you can use. So, lifestyle, healthy eating, physical activity are certainly some of those tools, but medications as well may be an important tool, again, depending on where you're at with your diabetes. We want to make sure that people have access to all the different tools that they have in their toolbox.
So it isn't so much controlled then with diet?
It certainly helps with managing your blood sugar, absolutely, absolutely, but so do medication, so do physical activity, so does managing your stress and sleep. So yeah, absolutely, all those tools.
Okay. And type 1 diabetes requires insulin to be injected into the body. And some people still use those syringes, but are there maybe some more advanced and convenient methods available today?
Absolutely. So we do have insulin pumps, and this is an alternative technology to the multiple daily injections, as you were mentioning. And they're about the size of a pager, they're portable, and you can program them to deliver insulin based on the amount of carbohydrates that you eat and that kind of thing. Certainly, some people find that the daily injections are a better fit for them, depending on what their circumstances are. So it's not to say that they're still not a great option, but certainly we do have additional tools such as the pump and some pumps that do connect to their glucose monitors as well that can really help them take better control of their blood glucose levels.
Yeah. I mean, yeah, it's got to be nicer than poking yourself with needles every single day. That's a hard way to live.
It is. It
Yeah. And I do understand that blood glucose testing is a necessary routine, of course, and there are a variety of methods that make testing easier than it used to be. And can you maybe explain what options are available and what kinds of costs might be involved?
For sure, for sure. So, yes, as I just mentioned, we do have glucose monitoring systems. We have the glucometer, which some people, as you said, can prick their finger and measure their blood that way. Those are also becoming more advanced as well. But we also have continuous glucose monitoring systems, and that is where people might wear a sensor and they're able to get a continual read on their blood glucose. And what that's been shown is to really help keep their blood glucose levels within their own individual target range. And it helps to reduce life-threatening situations like hypoglycemia, which is low blood sugar, and hyperglycemia, where the blood sugar gets too high, and helps to reduce the risk of complications as well. All that to say, These things are very expensive. So Canadians living with diabetes may need to pay between $10,000 and $18,000 per year, and in some cases out of their own pocket for diabetes medications, these devices, and the supplies. So while this technology does exist, it's not necessarily accessible to everyone. And that's why Diabetes Canada is really active in advocating for increased access to these devices and supplies.
Yeah, you mentioned in there hypo and hyperglycemia. Are those a form of diabetes at all, or are they completely something different?
No. So this is what can happen with blood sugar levels when they are not being managed well, either through medication or through the lifestyle activities that we talked about. So hypoglycemia is when your blood sugar drops too low. As we know, the body uses blood sugar for energy, and your brain is the biggest consumer of that blood sugar. So when it drops too low, you're at risk for some very severe consequences, dizziness, fainting, and in some cases, seizures. So it's definitely something that we want to be aware of and manage if you live with diabetes.
Okay. What are the signs and symptoms of diabetes? What should we be watching out for?
Absolutely. Yeah. So things to look out for sure. If you have been diagnosed with diabetes or if you think you might be at high risk, is unusual thirst. So be feeling very thirsty. And with that, if you're drinking lots, you might be urinating a lot as well. You want to look for changes in your weight. So either gaining or losing weight, extreme fatigue, lack of energy, blurred vision, cuts and bruises that are slow to heal, as well as any tingling and numbness in the hands or feet. So those are the symptoms that people can see. But oftentimes with diabetes, you may not have any symptoms at all. So often refer to it as a silent disease.
Yeah, that's scary. That's for sure. Because I mean, how many of us have had dizziness or tingling? I mean, now you're going to get us wondering. Go get checked out. All right.
Yes, yes, and that's it, right? It's knowing if you have a risk for it, and working with your healthcare provider.
Now, Candace, if someone has some of these symptoms, should they see a doctor right away?
They should. They should. The thing is, we know that sometimes access to our healthcare system can be a bit challenging. So we know that close to 1.8 million people live with diabetes in Canada and don't even know it. So it
Oh
is
boy.
something to pay attention to. The sooner you can get diagnosed, the better. And obviously, to work towards beginning to manage the condition. And this ultimately leads to better health outcomes. If you are experiencing signs or symptoms, please, seek medical attention, especially if there are those severe ones, such as blurred vision, feeling faint, those kinds of things. And if you have access to a healthcare provider, do make an appointment and have your A1C test done, which is a test that looks at your blood sugar levels over sort of a 3-month average.
Okay, so that's what the kind of test is that would be necessary to see whether or not you have diabetes.
Correct.
Interesting. So it's done over 3 months.
Yes, there
Okay.
are also testing that you can do where you fast and you look at your blood sugar levels after a fast as well. And there's also sort of impromptu blood tests that you can do to get a read what your blood sugars are at that moment. But the A1C test is really gives an idea of maybe where how your diabetes has progressed if it's something that you're potentially facing a diagnosis with. It just gives the healthcare provider a little bit more information.
So, what advice would you have for someone who has just been diagnosed with diabetes, especially if it's a child, because I understand children can get it as well?
Yes, they can. Yeah, so we just recently did a social experiences of living report, and we learned that nearly 90% of people, again, living with type 1 diabetes, and nearly 70% of people living with type 2 diabetes experience shame and blame around their diabetes diagnosis. So the biggest message that I would say is to remember that diabetes is not your fault. It's not that person's fault. There are so many misconceptions about this disease, and it's very complex, as I mentioned before. And even the treatments are complex as well, and they're different for everyone depending on the type of diabetes that you have. So, the best advice I can do is, or I can say, is just to remember that it's not your fault. Take the time. That's what Diabetes Awareness Month is all about. Is really about taking the time to learn and provide yourself, give yourself that knowledge to learn about how diabetes can be managed through the different tools that we have. And take that time to educate others as well through talking about it. That would be my best advice.
Yeah, and what kind of support is available for someone with diabetes? Is there a special website they should go to get that help?
Yes, absolutely. Well, of course, Diabetes Canada, we have a great website with lots of fabulous resources, and they're divided into different types, the different types of diabetes. So certainly come and visit our website at diabetes.ca. Also, you can learn a little bit more about our Let's Make Time campaign at diabetes.ca/, Let's Make Time. And you can certainly give us a call. We have a 1-800 number, 1-800 BANTING, and we have staff ready to help you with your questions and direct you where you can find more information. You can also email us at info@diabetes.ca if that is works better for you, but we're certainly here to help.
Wonderful. Thanks so much for being with us today, Candace. I appreciate having you on.
Thank you so much.
Candace Aqui is the Manager of Knowledge and Connection at Diabetes Canada.